Hi, my name's Tony Gravitt. I'm the Intelligence and Systems Lead here at Healthwatch in Devon, Plymouth and Torbay. Last year, we received quite a bit of public feedback in Plymouth in particular around a GP surgery group called the Mayflower Group. And the issues that were being raised by members of the public around that was being able to access the service. And also the way that they could access the service. There was also some issues around medications in terms of prescriptions and management of long-term conditions. The issues that were being raised weren't actually fully down to the COVID pandemic, as they were being raised prior to that coming in March and the first lockdown, but I think they were also exacerbated by the pandemic, and it was one of the areas that we saw quite a bit of feedback around during May, June and July when services were locked down, but equally as services recovered. We were being told that people were waiting up to 50 minutes on a phone call trying to access the service to actually talk to somebody about the issue they wanted to talk about. Although there was on the surgery website, they were being encouraged to use the e-consult system. Some people said they had tried that and they had struggled to use it. And equally, where the surgeries are located, there is a good percentage of the population are unable, either through skills or through broadband access or through having the technology at home to use the e-consult system and actually rely on the phone system to get into the surgery. We were also being told that issues around repeat prescriptions were becoming an issue, and patients, when they went to the pharmacy, were either getting the missing parts of the prescription and not really being given a reason why that was, and were having to go back to the surgery to try and get that sorted out. And it wasn't the case of it happening once. We were seeing same patients telling us it happened 2 or 3 times over a period of time. We were also informed during lockdown that people who were reliant on regular injections to manage long-term conditions, so vitamin injections, were being told that they couldn't be done at the time, and they would have to move to a vitamin tablet as a substitution. Some of these people were telling us that that really wasn't an option for them because of the level of the vitamins that they required to help maintain their condition. We captured all that information and themed it up, and we contacted the practice managers and the operational manager for the Mayflower Medical Group and raised all those concerns with the team there. They were quite receptive to what we raised, and in a couple of instances where we raised specific issues, they took those away to investigate and to contact the individual patients to resolve. But more importantly, they arranged a meeting for us to attend where we could have an open and honest conversation around the access issues, and they could give us some information around some of the challenges they had. They did respond to the observations we made and came back and said that they were reviewing all the access options to the surgeries. They were also mindful that not everybody was able to access digitally moving forward, but did mention that e-consult was a national programme that GP services are having to embrace. Overall, the impression I got from Mayflower Group is that the report was received well, everything was noted, and there is a genuine view to try and make things better, and they are reviewing their options around patient contact by various means, whether that be digital, be it on the telephone, and hopefully once the COVID pandemic is over, round face-to-face again, in terms of patients being able to talk to receptionists that way. From Healthwatch's point of view, our main role is to be a consumer champion for patients around the services they receive, and the way we can do that is to take your feedback every time you visit your GP or go to the pharmacy or go and see an optician or a dentist, or even go to the hospital, of how that experience was for you. Did it work? If it didn't, what didn't work? What went wrong? We like to hear what's good and bad so that we can really get a good picture of how services are working, so that we can then represent what's not working well to the providers and to the commissioners to allow service change to happen and make it better for all patients.